welcome to Anatomy with John and Scully. Today we'll be talking about the Anconeus muscle, going over origin, insertion, action, innervation, and blood supply. Thank you for joining. Alrighty, so Anconeus. Starting with the origin. Looking at the left side of Scully, it's going to originate on the posterior aspect of the lateral epicondyle of the humerus. It's going to insert on the posterior lateral aspect of the olecranon, as well as the posterior proximal ulna. It's going to receive innervation from the radial nerve coming off of nerve roots C5, C6, C7, C8, and T1. So let's count down. So C1, 2, 3, 4, 5. Nerve root exiting above would be C5 nerve root. Here's C6 spinous process, C6 nerve root, C7 spinous process, C7 nerve root, and then exiting below C7 spinal segment, we'll have the C8 nerve root, and then down to T1, also exiting below, we'll have the T1 nerve root. Okay, this is going to come down the brachial plexus. Oh, sorry, Scully. There. Okay, and coming off of the posterior cord in one of the terminal branches, we'll get the radial nerve coming down. It's going to pop posteriorly, and then it's going to travel. So radial nerve down here, it's going to follow the radial groove of the radial nerve, but we're going to get a small branch called the nerve to Anconeus, and that's going to come down and supply the Anconeus muscle through here. So once again, pops out below teres major, and then the radial nerve is going to follow the radial groove, but there's going to be a branch called the nerve to Anconeus traveling down, supplying the Anconeus muscle through here. Moving on to blood supply. It's going to receive blood supply from the profunda brachii, but if we start with the subclavian artery around here, which is going to turn into the axillary artery at the lateral border of the first rib, that's going to come down further, and at the inferior border of teres major, it's going to turn into the brachial artery. Once it's the brachial artery, it's going to dive down into the profunda brachii, back in through here. The profunda brachii is going to branch off to a couple different spots. So the profunda brachii is going to give us the middle collateral artery, which is going to supply Anconeus. It's also going to give us the radial collateral artery, which is going to supply Anconeus. Through here, we also have the posterior interosseous recurrent artery, which is actually going to come up through here and join the middle collateral artery, also supplying Anconeus. So there's origin, insertion, innervation, and blood supply. Moving on to action. It's going to help us to extend the elbow, so the forearm at the elbow joint. It's also going to help us to abduct the ulna in pronation. So abduct the ulna in pronation. So there you have it. Origin, insertion, action, innervation, and blood supply of the Anconeus muscle. As always, do not forget to eat your leafy greens, and thank you for joining. Take care, folks.